Hi everyone. We're live today, talking with Amy from VACCHO here in unfortunately lockdown again, Melbourne. So before we start, I'd like to acknowledge the Australia's Aboriginal and Torres Strait Islander peoples, the traditional custodians of the lands, waterways and skies across Australia from where you are listening from. I'd also like to pay my respects to elders past and present and emerging, and to other Aboriginal people listening in today. I'm broadcasting today from the lands of the Wurundjeri people of the Kulin Nation, which is I think where Amy is located as well.
Yeah.
Excellent. So thanks for joining us today. And we'll get started, I think, with Amy's going to give us a bit of an introduction to herself and to VACCHO. So over to you, Amy.
Thank you, Alice. Nice to be here today. So my name's Amy Rossignoli. I'm a public health nutritionist at VACCHO, the Victorian Aboriginal Community Controlled Health Organisation. So VACCHO is a peak body for Aboriginal health here in Victoria. It's only of its kind, and we have 32 Aboriginal community controlled organisations as members. And our members support over 25,000 Aboriginal people here in Victoria. So I guess in terms of like what we do, we lead and support our ACCOs, so the Aboriginal Community Controlled Organisations, and the broader health and social services sector to deliver transformative health and wellbeing for our Aboriginal peoples in Victoria.
Excellent. And you operate out of that amazing building behind you in your background, although both of us are from home today.
Yeah, unfortunately. But yes, we have the beautiful mural on our building in Collingwood, on Wurundjeri country.
Whereas my background today is brought to you from my messy craft room, and including bags of clothes waiting to go to charity donation. So anyway, it's a different type of professional. We'll be fine. The reality of working from home at the moment. So today the reason that we thought we'd get Amy and VACCHO in to have a chat today was about really about the Rethink Sugary Drink Alliance and their work as part of that alliance. And Parents' Voice has been a participant as part of Rethink Sugary Drinks for a number of years as well. And so we've seen firsthand the great work that VACCHO has done over that time. And we thought it'd be a great opportunity to highlight it to everyone else and help inspire people really to be thinking about water and what you could be doing in your local settings. Be inspired like we are to take some action in your local settings around sugary drinks. So shall we dive into Rethink Sugary Drink Alliance? So what's it about? Why are we both part of it? Do you want to kick it off, Amy?
Yeah, sure. Well, I guess in the Australian diet, we know that more sugar comes from sugary drinks than anything else. So in terms of, I guess, like the health impacts of having a lot of sugary drinks in the diet has brought together a lot of peak bodies and organisations to try and raise awareness. So I guess when we're talking about sugary drinks, we're referring to sports drinks, soft drinks, energy drinks, commercially made fruit drinks, slushies, iced teas, and cordials. So just to get that across, generally commercially made products. So these drinks, I guess, can cause an array of different chronic diseases, such as dental issues and unhealthy weight gain, diabetes, some cancers, etc. So the Rethink Sugary Drinks, or Rethink Sugary Drink Alliance, came together with 19 national and state-based organisations to raise that awareness about the amount of sugar in these commercially made products and encourage Australians to opt for water rather than buying into these drinks. So That's a bit about, I guess, the Rethink initiative. Yeah.
Excellent. And that's, I think, really highlights why parents' voice is part of it too. It's often, sugary drink is a very large concern for parents, and one of those things that's often offered in lots of different settings to children, you know, as fun drinks. And in fact, I was thinking when you were listing all of those different examples of sugary drinks, that one that we're seeing even more at the moment is bubble tea, which is less like it, you know, you kind of form it yourself, a little bit like those old kind of ice cream places where you pick all the toppings. It's kind of a similar thing, but that people tend to put a bit of sugar in them. And so particularly parents of teenagers are kind of going, what are we meant to be doing about bubble tea? So I don't have the answer. I don't think Amy has the answer to bubble tea, but anyone listening, we're thinking about it and thinking about how we can incorporate it into some of our work. So what's VACCHO been doing as part of Rethink Sugary Drink?
Yeah, so I guess VACCHO joined the Rethink Sugary Drink Alliance back in 2014. So we knew that around 1/4 of Aboriginal and Torres Strait Islander adults and about 1/5 of children were consuming sugary beverages, and recognising that we needed to share or raise that awareness within the Aboriginal community, and also join forces, I guess, with other organisations to be able to make a powerful impact. VACCHO joined the Rethink Sugary Drink Alliance, and that led to developing some really awesome campaigns together to raise that awareness. So yeah, I guess that's how we kind of got involved, and yeah, I've been a member ever since.
Excellent. So we're hoping that we can play an example for you this afternoon of one of the, was this the first collaboration, the first bit of collaboration that, yep, excellent.
Yeah.
So we're hoping to play that fair, you know, streaming technology allowing, but maybe you could tell us a little bit about this campaign before we jump into looking at it.
Yeah, sure. So the campaign that we're going to show you is called 16 Teaspoons. So it's the Aboriginal Rethink Sugary Drink campaign, the initial campaign, I guess. So 16 Teaspoons isn't a TV ad originally. Now you can see it on many different platforms, but it was developed in partnership with Cancer Council Victoria, with the support of the other organisations on the Rethink Alliance. So it was first aired on National Indigenous TV back in 2015, and it was the first kind of social marketing, I guess, campaign of its kind to really target sugary drink consumption for the Aboriginal and Torres Strait Islander community. Yeah, so do you have it to play?
I do. I've got it loaded up. Let me jump in, and we're hoping it plays smoothly. Otherwise, Evie's on standby to stick the link in the comments on Facebook. So fingers crossed.
You wouldn't eat 16 teaspoons of sugar in one hit, would ya? So why do we drink it? Auntie Anne at the health service said all that sugar would make you put on weight and make us sick, Mum, with like type 2 diabetes, heart disease, kidney disease, and even cancer. It could even rot your teeth. Hey, go with water instead. It's too deadly.
Excellent. I have to say, I really do love that video, and long time followers of Parents' Voice, supporters and members will have seen it before because we would have shared it at the time when it came out. And I've been informed that it did stream relatively well on the other end, so that's good.
Yeah, played well. Yeah.
Excellent. But we'll make sure the links to all of these things are sent around anyway to members so that they can have a bit of a look in their own time and share them. That's the point as well, isn't it? So can you kind of talk to us about the importance of campaigns like this? How did you go about developing it? What was really important as part of that process? And how did you measure the success of a campaign like this?
Yeah, great. Yeah, so at the time, I think the nutrition team, which I should disclose I wasn't part of at the time, so it was before I joined VACCHO, but they really wanted to move, I guess, to a real whole of community approach with their health promotion. So kind of moving away from an individual approach, and then therefore, I guess you get more support and empowerment by having all levels of, community involved. And this approach actually worked extremely well. So first, I guess, the nutrition team at VACCHO consulted community, which is, I guess, best practice working in Aboriginal health. And so, one, asking staff at VACCHO what they would like to see in this campaign and what was important to them. And then also consulting and having conversations with communities. So working with our members, Aboriginal health services across Victoria, and getting their thoughts and, what would make the ad, I guess, kind of personalised to them. And some of the things that came out through that conversation or consultation was to not stigmatise, and I think that's a big thing, especially when we come to talking about health promotion and public health. Like, we really want to empower positive behaviour change and not make people feel guilty, or we know that there's a lot of challenges out there when it comes to choosing food and drinks, and that can be reliant on a number of different factors. So really important to not stigmatise or shame, use a strengths-based approach. And also something that this ad really focuses on, which you may have just seen if you watched it, it had really strong community and culture elements to it. So it had family, in like family setting, watching local football. It had, from the babies through to the parents. So lots of different role models in there as well. And it really was centered around culture and language. So I think that's some of the things that really paid off for its success and resonated with the community. But in terms of this campaign, I guess, being so successful, because obviously it's been around for a number of years now, can also be paid to the fact that when they set up the campaign, they made it multifaceted. So it was really comprehensive in the ways that it was promoted. So one, there was the TV ad that you just watched. So there's a 1-minute version, which is really great. You should definitely watch it if you have time, to the viewers. And so then there was also the Rethink Sugary Drink website, and Facebook advertising also really supports getting health promotion messages out there, especially when we're up against, the food industry that I wouldn't hate to know how much money goes into advertising these exact products that we're trying to, encourage people to go without. So
it's probably bigger than the entire health budget for Victoria, almost. Not quite, maybe, but it seems that way.
Definitely. We also had merchandise, so to really drive that message home and lead to be able to have some behaviour change. There was drink bottles, bags, fridge magnets developed to go along with the campaign as well as the social media competitions. So there was a few ways that community could really engage with the campaign, and I think that's something that can always be, should be, I guess, seen as a kind of best practice model, so that you are getting to your audiences in different ways, especially if you're looking at, a community or a population where there's different ages as well. So knowing who you're trying to get that message to and where they might interact with it. So I guess that's a bit about the development and how it was done. So in terms of how we evaluated, there was a couple of online surveys that were circulated around VACCHO staff and also to our members, but then again to the Rethink Sugary Drink Alliance network. So it got out to not just Aboriginal and Torres Strait Islander communities, but also non-Aboriginal communities as well. So yeah, through that evaluation, we found some really interesting and great outcomes. So one, we found that the Aboriginal community found it culturally relevant, which is great. And also that it increased knowledge. So when you're trying to raise awareness, I guess one of the best things that you can get from something like that is an increased awareness and knowledge. So respondents said that they liked that it encouraged community members to drink fewer sugary drinks, and also supported campaigns that really showed how you can also reduce the intake as well. So at the end of that ad, I guess one of the strongest messages there is to go for water. It's from nature and it's free and yeah, accessible. So I think that's something that was really positive about that campaign as well.
Yeah, we're definitely encouraging people to take a different action, making it really clear and easy and simple for them to do is quite a hallmark of good public health campaigning. Yeah,
that's right. Yeah, I think something else that we found through that evaluation was that because it was initially went on NITV, but early on to the campaign, there was an evaluation of its reach, and it was discovered that some of the Aboriginal community that were watching, interviewed, actually watch commercial TV more than NITV. So then the nutrition team decided to put it onto WIN regional network, and that just meant that the reach was so much greater, and it also reached more populations in communities as well. So I guess overall it was shown through the evaluation that the messages not only were effective with the Aboriginal community, but also with the general population.
Which is excellent. I can tell you effective on me. Not that I'm too prone to drinking sugary drinks given the job that I do, but I thought it was at the time it was quite effective, and still think that it communicates its message really well.
Yeah.
So you were talking about how one of the things with this campaign is it wasn't just the video, there was other components to it. Have there been other campaigns that VACCHO has run around Rethink Sugary Drinks that have had other components, or have been, you've worked in like local community settings or other things like that to create change in other ways?
Yeah. So I guess from the success of the 16 teaspoons ad, the nutrition team decided to, well, as I said earlier, created some merchandise. So one of those was the Drink Water You Mob drink bottles. So if you can see this one here, when we start at VACCHO, you get a drink bottle, which is great. Always encouraging the hydration at work. But that has been a huge success, and being able to have something that's tangible and actually delivers that message about drinking water rather than sugary drinks makes it that much easier for community when they've got a vessel to make that happen. So I guess what the nutrition team did and still does today when it's not COVID times and lockdowns is go to community events and go to big carnivals where people are going to be and having a good time, and when generally people are maybe going to spend some money on food and drinks. So we'll go with a Drink Water You Mob stall and hand out drink bottles, donate drink bottles to the teams, and I guess that's something that we've taken a step further and offered our members and any Aboriginal organisation in Victoria or program is water pledges, offering the drink bottles to these organisations and programs on the basis that they show us or tell us how they're going to promote water and potentially take a water pledge. So that's been a really great way to create change on a local level right across Victoria. So I think the Drink Water You Mob bottles are a great way to get yeah, I guess to that community level. And I guess on the back of the success of 16 teaspoons and the reach that that could have, and the feedback, we then created 2 more campaigns. So one was Sports Drinks a Gammon, which is all about, you know, not buying into the fact, you know, they're advertised or promoted to be an essential drink when you exercise. And that might be the case for professional athletes, but not for the everyday, you know, weekend warrior, or sitting at your desk and needing a pep up, or even just kids sports. So that whole campaign is just really focuses on local sports people in the Aboriginal community and their story about how they have, you know, learned about, I guess, sugary drinks and prefer to drink water. So I think something always like important to discuss when it comes to like Aboriginal health and, you know, the current situation with chronic disease and things is that Aboriginal people were here in Australia for, you know, 60,000 years before colonisation, and they lived off this land, and, you know, they were healthy, and they still are today, but we've had some really, you know, terrible impacts from colonisation, and the food environment has changed significantly, even for, you know, Western societies, and our bodies are still trying to catch up with that. And obviously having these commercially made products everywhere you go, advertised all over the place, social media, TV, you know, on buses, transport. So I think, yeah, it's just always important to come back to, you know, how these issues have come about, and trying to work out ways to empower, I guess, people to, you know, choose, I guess, food and drinks that make them feel good, and yeah, that are from nature, and that give us nutrients, and that really support our health and well-being. Yeah.
So true, so true. And I can see a real connection there between the Drink Water U Mob and the community and sports days, like that, and the kind of the next step, which was the Sports Drinks a Gammon. Like I could almost see someone's progression there around, well, we're seeing these sports drinks, we're only having so much impact with the Drink Water U Mob, we need to have another messages there. And Evie will put the link to the Sports Drinks a Gammon ad in the chat on Facebook, and we'll be sending it out afterwards as well. Maybe actually, I just realized there's potentially a gap in knowledge. Can you explain what gammon means for people watching?
Yeah, absolutely. So gammon means like fake. Yeah, so I guess another strength of that particular campaign and Drink Water You Mob is using language that is Aboriginal English language, and, you know, therefore the community knows it's for them and it speaks to them in their language. So yeah, absolutely. That's where gammon came from.
And I can recommend that particular campaign to anyone who's trying to convince their local sporting club that they shouldn't be selling sports drinks, particularly not to children. Really tells the message really quite clearly and simply about, like you said, the falseness really of sports drinks. So
yeah, that fakeness or falseness of that advertising. Yeah,
exactly. And you had the Our Stories campaign as well? Yes.
Yeah, so Our Stories is a really beautiful campaign that talks to everyday people in the Aboriginal community. There's Uncle Daryl, Rumbalara, Aboriginal Health Service, talk about how they've, I guess, their story about moving to drinking more water rather than sugary drinks as well. So it's just that, you know, everyday person and their story about, yeah, I guess, you know, maybe having some health implications, or just wanting to improve their health and well-being, and also for their, you know, workplace or their community environment as well, and how they've gone about making those changes. So I guess it kind of goes from, instead of being like a case study, storytelling.
Yeah. Which is so powerful in this, people sharing their stories and their journeys can be so powerful. So again, we'll put those links in the chat because we don't have enough time to watch all of the amazing stuff that VACCHO has done. And we're running short on time now. So do you have any suggestions for how people watching can kind of take some of these ideas or the concept of reducing the consumption of sugary drinks, so rethinking sugary drink, into their own communities?
Yeah, one, I would definitely go and check out the Rethink Sugary Drink website and the VACCHO website, and see what resources are there that you can use for your community, and whether it be like a school or a childcare. I'm sure there's some posters or fact sheets, or some fun activities as well that you can do on those websites. So being able to run I guess local community events that really, promote healthy drinks or healthy food is one way that you can do something on a local level. And I guess also it's important to have some ammo with you. So having some stats or, some resources, some evidence behind you when you're talking to people that you need to, the decision makers, whether it be at like a school and wanting to talk up to the principal about making, changes for that school environment, having some of that material there so that you feel supported and can really make some noise and get people around you to support those changes that you want to make.
And can I say, I think there's some simplicity, like some beauty in the simplicity of the message of choosing water, because it means you get less into the nitty gritty arguments with people about whether certain drinks with added sugar have some benefit, like flavored milks or juices. We just say that water is the preferred choice, the preferred drink, and we're leading with that. It does help cut through some of that conflict, I think.
Yeah.
So I'm going to ask Evie if there's any questions in the chat, and while we're waiting for that to come through, can you tell us quickly what's next for VACCHO in terms of this kind of unhealthy drink, unhealthy food campaigning?
Yeah. Okay. So I guess at the moment we're always doing a number of different things, but we'll be kicking off some really exciting research with Deakin University on a project called Food Paths, and that will be working with our member ACCOs and communities to, I guess, improve food policy around the food environment. So empowering the voice of Aboriginal communities to have more say about what's in their food environment. And there'll be a really great campaign coming out for that, a cultural campaign, but it's not quite ready yet. So I think it's a watch this space. And hopefully we can promote that by the end of the year. So
excellent. Yes, and I've had, not to get Amy in trouble, I've had a little bit of a sneak peek, and I think our parents will be really interested in some of the messages coming out from VACCHO over the, whatever the period in the future when they get to when it gets released. So yeah, keep an eye out for that. And so we're going to put all of the we've put the links to the different videos we've talked about today in the chat, but we're also going to send it out as in the e-newsletter with some extra links and making sure that people can access them and be inspired like we have been. We've got a question. Have you been operating any of these campaigns during the complicated COVID times? Has it changed a shift in messaging?
I guess there's been some other really important campaigns during this COVID time to support community, and but in terms of the Rethink Sugary Drinks, I guess being online a lot more than we probably would otherwise. I guess we've been able to continue promoting these campaigns, because I guess the great thing about them is that they're still really relevant today. So especially, being at home, and sometimes we need a bit more encouragement when things are getting tough. So yeah, I think just, also using what we've got and yeah, just getting them out through our social media, our Twitter or Facebook, and just engaging with the community during this time. It's really important.
And I would urge anyone with some time on their hands, there's been some really great messaging that's gone out around COVID and coronavirus and staying safe from the various VACCHOs in Victoria. And it really just mostly it highlights that connection that we talked about earlier around co-designing with the communities that you're communicating to, and that really showed the power of all of the of VACCHOs in general. Really, I think that their communication's been spectacular on that. Well, we've got one last question. We've just hit time, but we'll take it. Any tips or tricks to make water an exciting choice for kids?
Good one. Maybe Alice, I can throw this to you. You're the mum.
I don't know. My daughter loves ice. Like she just likes regular ice blocks. So I don't know if it's not very exciting, I don't think, but she loves them.
Yeah.
Maybe just try freezing regular water and see if that helps. Do you have any other tips, Amy?
Yeah, I guess we always say being able to flavor maybe some water with, natural foods. So whether it be some cucumber, if your kids love eating, cucumber, or putting some berries or oranges or something in the water to just infuse it, give it a little bit of an exciting flavor. Can be a good way to get, I guess, kids drinking more water, or when they've been running around and really thirsty, quickly giving them some water can be a positive reinforcement as well. So
definitely. So there's a space for role modeling for parents to drink water as well. And with the berry tips, you can also put frozen ones in. They defrost pretty quickly in a glass of water while chilling it down. So it's a win-win there. I have heard that parents of small children calling water tap juice, so that kids think that this idea of things in popular media where it's like, oh, I want a glass of juice, and then small kids think that is actually water. I'm not sure if that might backfire on you a little bit later as they get older, but it was an interesting choice from parents.
Yeah, what works is always good to go with me at the time.
I have had dietitians say you just go with what works, and then when it stops working, you adapt.
Yeah, that's good advice.
So I think we'll leave it there. And so thank you everyone for tuning in, and thank you, Amy, for joining us and sharing the work that VACCHO is doing in this space. The recording from today's chat will be available in our videos section of our Facebook page for anyone who's missed part of it or who wants to rewatch it. And obviously, as I mentioned, we'll be sending out all the links from today's chat. So don't forget to check out the VACCHO website to see what they're up to. And if you're inspired by the work of Rethink Sugar Drink, their website, as Amy mentioned, has a lot of great resources for downloading and sharing in the community. So I'm going to finish us there. But I would just like to say that if anyone has an idea for a topic that they'd like us to cover as part of this chat series, please just reach out via email. So hello@parentsvoice.org.au, or send us a message on all of the different social media platforms. Obviously, Facebook is where you're watching today, but any platform will be fine. We're keen to take people's suggestions and make sure we're covering topics that everyone's interested in. So thanks again, Amy, for joining us.
Thank you so much for having us on board. Yeah.
It's been great.
Sure has.
Thank you, everyone.